My name is Nick. I'm a teacher at Lingua. Before joining Lingua, I was the head teacher at Sydney College of English. I was in that role for about 3 years. As head teacher, I was responsible for class scheduling, curriculum and development, and the professional development of teachers. Prior to being a head teacher, I was a regular teacher for SCE and GEOS. Now, GEOS, as you may know, is a famous language school in Japan that has since closed. So I've been working in the ESL, or English teaching industry now, for over 20 years. I have extensive experience in teaching general English, Cambridge, IELTS, and OET and EHP. So I'm looking forward to sharing my broad range of knowledge with prospective students, future students, and hopefully ongoing students, so we can prepare them for a career in Australia in nursing.
The course is for, okay, I'm just reading. It is aimed at professional students trained in other language different from English professionals, such as nurses, pharmacists, dentists, and medical students. We recommend these, the people who may be working as nurses, pharmacists, or maybe the people who want to be nurses or pharmacists, something like that. This course is good for them. Okay, because next, what can you learn from the course? Okay, what can you learn from the course? Okay, medical vocabulary. I'm just reading. Its pronunciation used in a different context. The grammar needed to receive information, process it, and convey their message across effectively. Okay, strategies to efficiently approach readings related to their professions. Details of spoken communication in different medical settings, such as hospitals, medical centers, and aged care homes. Okay, what's next? What is next? Okay, how can you take the course? How can you take the course? If you will take the course, how? Okay, so this is very important. The lesson, if you're in Japan now, if you're in Melbourne now, if you're in England now, you're still allowed to take this course because the course actually the running online. So I think almost confirmed, I think 99% we're using Zoom. Zoom is the one we're now using, Zoom one, online lesson. And the course length, 12 weeks. 12 weeks, course runs for 12 weeks. And days, we only have Tuesday and Thursday, means like only 2 days per week. Sorry, this I have to actually say, sorry, apologize for the people who already received this materials from me. Actually, we changed the day. Okay, their original plan was Monday and Thursday. Sorry, this is the confirmed one. So we changed the day of the course class from Monday and Thursday to Tuesday and Thursdays. Okay, Tuesdays and Thursdays. Sorry for this, make you confused. This is confirmed one. No, Monday, Tuesdays and Thursdays. And the time, okay, the senior time, 7:30 to 9, 7:30 to 9 in the evening. So 1.5 per lesson per day. So means Tuesday and Thursday, 1.5 per day means 3 hours per week. 3 hours per week. And the fee, 1,200. This is very special fee for this, the new course, the first course, okay? And then the enrollment fee even waived. Okay, so they are only 1,200 for 12 weeks. Very special. Okay, and the level required, if you want to take this course, of course, the unfortunately, if you never study English, you better actually have to take the exam, IELTS exam, or maybe have to take our placement English test before you enroll. We're going to talk about more about the placement testing later. Okay, so but the level required pre-intermediate and above. Pre-intermediate and above. And then this is also very good thing. And then because more maybe like many of people for taking this course, maybe working as a full-time or maybe casual or part-time. Anyway, they're working. So if you miss the class, okay, so don't worry because the lesson will be filmed. Lesson will be filmed and allowed to watch later if you missed. Okay, this is good thing if you're working as a full-time. All right. Okay, so then we're going to the textbooks. What kind of textbooks we're going to use? We're going to use the looks like 2 textbooks, but they are the 1 and 2. Maybe we can ask more. I can ask more about the textbook to Nick later. The name is Nursing 1 and 2, and then the publisher is Oxford English Book Carriers. Okay, we can just maybe if you have any questions about the textbook, maybe I will ask more later to Nick, and then maybe if you want to ask more questions about the textbook, you can ask the more about textbook to Nick later.
As you said, the first option is to buy a book. That's always preferable. It's always good to have a book with you. So when we do the activities or when I present the activities via Zoom, the the student can write their answers in the book. And putting pen to paper is always a good tangible way of learning. However, if you don't buy the book, that's fine because you can follow my lesson on Zoom. I annotate everything on Zoom. And I will send a PDF to the student for that day's lesson. So for example, if we're doing pages 6 and 7 for a 1.5 hour lesson, I can send the PDF to the student. So the student can print that or have that on a tablet and they can use that, or they can simply follow the lesson on the screen. As I said, the answers are animated or annotated depending on how I present it. And the student just needs to follow the lesson. So it's really up to the student. A textbook is not necessarily required. However, it is preferable.
Yeah.
The EHCP course is based on 2 books which focus on different situations where different language requirements are necessary in hospitals. The EHCP books, the nursing books, work on grammar, work on vocabulary, but not medical vocabulary. Medical vocabulary is the context. The learning component of the book is more using prepositions correctly, using English tenses, past tense, present tense, future tense, making requests, discussing plans, talking about procedure, medical procedure, but using the right vocabulary. The book is focusing on those general skills. OET is a test preparation course. So OET assumes that you already have these basic English skills. And OET tests your ability to write reference letters, discharge letters, if you're a doctor, a listening test, a speaking test, so an interview. It's more like an IELTS test. So think of OET as an IELTS test testing your skills, but EHCP are general English skills in a medical context. I would base the homework on the textbook. So I would assign homework from the workbook.
Okay.
That could just be a simple close activity, a grammar activity, or can even be a short writing. The book covers the 4 main skills of English: writing, reading, listening, and speaking. Obviously, speaking cannot be done as homework, but writing can. So there would be some writing. Also, there are activities or exercises that assess grammar. Homework is your choice. It's up to the student to do homework.
Okay, that's
If
good.
the student wants to do the homework, that's their choice. And I always, if you're busy and you're full time, and you don't have time to do the homework, I'll always send you the answers. You can do the homework in your own time.
Very good.
Yeah,
Very
a lot of
helpful.
the homework that I set, I give the answers with the homework. So it's really up to the student. You've got to give the student the flexibility of doing homework when it suits them. I'm not going to spend class time checking homework. I'm just going to give them the answers. For writing, though, I'm happy to correct it if they send it to me. There are 2 ways to become a nurse in Australia.
Yep.
You need an IELTS score of 7.5 or 7, depending on the university, or you need an OET pass grade of B. OET is assessed from A to E, and A and B are pass marks for admission into a hospital to be a nurse. So the way to become a nurse in Australia is, firstly and most importantly, is to improve your English skills. And that's what the course addresses. The textbooks that we offer help the students improve their general English skills in a medical context. Once students have the confidence to express themselves and communicate to a level, acceptable for a B pass or an IELTS score of 7, then I would then recommend the student to go on to do the OET course or attempt IELTS. Yes, so once they achieve a B in OET or a 7, then they are admitted into university to study nursing. So an OET is not going to get you to nursing. You need an OET plus a relevant university degree to do that. So it's not an easy thing. It's a long road. I know plenty of people from Sydney College of English, actually, my previous school, who've gone on to be nurses in Australia. And a realistic time frame, honestly, would be a year to 2 years study, English study, then either the OET or IELTS course, the OET or IELTS test, and then university. So if you add all this up, you're looking at a 4 to 5 year plan. But if your English level is very high, so for example, if you're an upper intermediate student, you would only need to do this course at Lingua for 6 months, and you would probably be I think doing the IELTS test would be probably easier for you, and you'd have a better chance of getting the required mark. Right, okay, that's a great question. I'm glad you asked me that question. Absolutely. Now, if your English level is an IELTS 5, you can work in a nursing home. If you have a working visa, this course is perfect, because it teaches you these English communication skills that a lot of workers need in a nursing home. All the vocabulary in this book is fantastic. It's set in a hospital. Now, the type of language that's used to communicate in a hospital is exactly the same, or almost the same, as the language used in a nursing home. So when I was at Sydney College of English, there were lots of students who were working in nursing homes, earning good money, earning good Australian money. And they were studying at the same time. So this course would be a perfect course to do while working in a nursing home. When your English improves, then you go on to do your IELTS, your degree, and then you can move into nursing, medical English, or whatever career you decide to do.
Good.
So just to answer that last question ago, if so, where can I work? Initially, nursing home. Eventually, as a nurse in a medical institution.
What can I learn from this course?
Okay, so you would learn grammar, vocabulary, reading, communication skills, everyday English skills. You'd also learn writing, so writing text types, how to write a letter, how to write a discharge letter, a referral letter, how to write in contexts that are necessary in a hospital. So in terms of grammar, you would learn tenses, you would learn prepositions, you would learn the correct way to present situations using grammar. It would be similar to think of it as a general English book, but it's set in a hospital.
Oh, okay.
So imagine a general English book has a topic on the environment, has a topic on travel. Well, this book would have a topic on how to communicate in an emergency ward, how to talk to a patient, how to explain things to a patient.
And Nick, you said you've seen a number of your students go on to work in hospitals. Which hospitals? Hospitals all in Australia or any?
Yes, in Australia. So St. Vincent's, which is a large hospital in Sydney. I also know of 3 students who now work for Prince Albert Hospital, also in Sydney. Okay. They were students. They were general English students who went on to do the very books that we're promoting today. And then they took on their journey through university and either an OET and IELTS. But let's not pretend here it's not a short journey. It's a long commitment. And I would say, depending on the student's level, it could be anywhere between 2 and 4 years. Our job is to teach them English, and it's the student's responsibility then to go to university and do the OET test and IELTS test. But La Lingua, we are at the very start of their journey.
Yes. Okay. Thank you.
Now, I would just like to say how convenient this course is, because at the moment we're in a situation where international travel is quite challenging for everybody. The borders are not open yet. So if your students are interested in preparing for a new career, a new life as a nurse or a medical professional, now is the time to start. Now is the time to actually start your study. And you can start your study in the convenience of your home. Home. Well, you can, yeah, that's right. The convenience of your home. You finish work, you come home, and you start now. Because in 6 months or a year, I don't know when, the borders will open. Yes. And it's good time to start now, and then come to Australia and continue your study. But delaying your study is not going to be sort of helpful if you want to start a career as nursing. I think the time is to start now. And I think that's important for all of you to understand. So when you are marketing to your students, prospective students, I would be marketing that course now so they can at least get a head start. For a nursing home, definitely, because the certificate is proof of competency. Yeah. Now, nursing homes don't require an IELTS certificate. They require the students to have a reasonable level of English. Having a certificate from an approved English provider like La Lingua, is proof that the student is
Mhm.
has an acceptable level of English competency for the job.
Okay.
Yeah.
Okay, that's good. Good to
My
know.
pleasure.
Yeah, thanks.
My pleasure.
So I hope you enjoy the workshop today. And thank you very much for joining Nick and Julian and Minja.
Thank you very much. What a pleasure to
And-
meet you all.
Thank you, Nick. Thank you, Tomoko.
Thank you very much. Thank you.
Living the
Shadow.
dream, living the Lingua dream.
In Australia.
Okay, thank you very much.
Thank you. Bye-bye.
Okay,
Thank you.
bye everyone.
Bye.
Kiosk
Bye-bye
again.
from
Thank you very
Australia.
much. Thank you.